So currently in Ghana, we have a confirmed cases of 70,046, and then we have a death toll of 449. We have a massive recovery rate, which is 63,502 at the moment. So yes, you could see back in 2020, from March when we last met, we weren't recording much, especially even with the death toll. But now it seems we've increased our death tolls. Yeah, but comparatively, I could say this country, as of February 2021, we are doing very well with the management, looking at our recovery rate of 63,502.
Is the Ghana healthcare system able to cope with the situation right now? Probably during this question, you also can talk about your personal experience and your work you're doing right now at Prepah Hospital.
Yes, I would say yes, the country health system is able to cope, looking at the protocols and then adequate PPEs and then increase in infrastructures that has been in place. So with my personal experience at Kolebu Teaching Hospital, where my unit is currently a treatment center for COVID patients, yes, I could say yes, we are handling the issues of our daily activities very well, since we have good structures in place to handle them.
What has the government done so far to prevent and control the epidemic?
Yes, so the government has really done well, in my opinion, with the management of COVID as it came up. Yes, basically, the government has increased infrastructure around the country. We had an infectious disease center being built within a short period, which is 100-bed capacity, and then we also converted some facilities around the regions into treatment centers to enhance with the management of the COVID patients as well. The government also has put in such other instruments also in place, such as social distancing and then hand washing, and then education too has also gone into as well, and then the wearing of masks, which a law has been passed on that as well, and then it's mandatory, and then there are law enforcement agencies around towns who are making sure that yes, people go by wearing their masks, and then if you don't do it, yeah, it's a crime as well, and then you could be arrested, and you could be fined too as well. Yes, so these are some of the few things that the government have put in place to ensure that the COVID is being handled well in this country.
What about the borders? Have borders been closed?
Yes, so with our inland borders have been closed, and then
So you
that's
can't
from
travel by car
so you
from
can travel
Togo
to
or
Togo.
Burkina or to
No,
Cote d'Ivoire?
no,
No.
it can't be done. It's only goods that are being allowed to come through, but then as with passengers, it's not done. And then when it comes to with the airports too, yes, there are strict protocols too at the airports, where when you come, it's mandated that you undergo a COVID test. To prove that yes, you don't have the COVID, and there are situations where sometimes you have to even go for self quarantine for the 14 days too as well. So yeah.
Yes, I experienced it myself. Upon arrival, I had to undergo antigen tests at the airport, and it was negative. And so I was able to visit Ghana.
Sure.
What about testing? Who is tested and how many have you tested so far?
Okay, so with the question who is tested, currently as of February 2021, anybody can be tested. The government just made testing free for everybody, so you can just walk into any public laboratory service center, and then you can get tested. But before then, when the last time we met in 2020 March, yes, it was only those who are probably symptomatic, and then who were contact traced from someone who had been tested positive, that were being aggressively tested. But as it stands now, there are more asymptomatics. So now it's widely open for anybody who feel wants to get tested, can easily go to get tested. And with a number of the exact figure, Dr. K, I can give you an exact figure at the moment, because I believe we've tested over 100,000 Yes, we've tested over 100,000.
Regarding the waves of the epidemic, I mean, there was a wave at the beginning
Yeah.
in March, and apparently the numbers are rising again a bit.
Yes. So in March, because we started with an aggressive testing, yes, we had numbers rising, and then somewhere within June, August, September, yes, they declined. Even in September, it was flat. I could say that because even as of September, most of our treatment centers started closing down around that time, and unfortunately, within November, heading to the December, yes, we started picking up figures again. And then as I speak to you with the figures I mentioned, even with our death toll, it could tell you that our numbers had also quite increased. Looking at the pattern.
Why do you think you have the second wave of patients?
Yes, I think, to my opinion, there was a time I think probably as the whole country, everyone left down their guards, especially when the cases were declining, and then I think the perception was, oh yes, COVID is about leaving, so now we cannot go back to our normal lives of
Until
now
they got
putting
loose.
on, yes.
Okay.
And then in December was there was much activities in this country where December 7th we went to the polls to elect a new president, and proud to that. I mean,
There were election time
yes,
and Christmas.
yes,
so
and
all-
Christmas too as well.
Yeah.
Yes, so there were a lot of campaigns, a lot of activities during
Okay.
the December. Yes.
Okay. Is there a vaccine already in the country?
No, so there's no vaccine already in the country, but then the government is making plans towards it, and then we are expect to receive the first batch of vaccine in March. But as of now, the government haven't declared the exact vaccine that we will be getting.
Okay. Are there any mutations have been detected already in Ghana?
Yes, so we detected the UK variant.
Mhm.
Yes, we detected the UK variant at our airport, that's Kotoka International Airport, last month. Yes, so that's the new variant that we've detected
And
so
from
far.
South Africa?
Yes, and from South Africa too as well, Dr. K.
Okay.
Yeah.
From Brazil and
No, these
okay.
are the only two countries that we've detected.
Why has Ghana so far not been affected that much like countries in Europe or the US or in
Yes.
South America?
Yes. This remains a mystery till now. Simply because there are so much factors that a whole lot of people are contributing to this, because we don't really have an exact reason why, but then we could also attribute some of these factors, such as probably with our age distribution. You could see that with this country's population of over 30 million, we have quite a great young age dominating this 30 million, so it could be a factor. And then also Ghana had been hit with a similar epidemic before, the Ebola. So I could say this has much already prepared us, and then with the Ebola experience, we already had our systems in place. So yes, I could see that yes, it's because of all these that we're able to handle it as well.
How do you see the future of Corona in Ghana? I mean, this is a question towards the future. What is your personal point of view?
Okay, so in the future, I see that this country will be able to handle Corona effectively, because looking how far with our performance, yes, nothing withholds my opinion that we'll be able to handle it effectively.
My last question, I plan to come in January 2022 with a group of doctors from overseas to Ghana in order to teach them on tropical infectious diseases. Do you think this will be possible to attend ward rounds in Ghana hospitals, provided the visiting doctors have been vaccinated against Corona?
Oh yes, you can. So far as that you get to the airport, you abide with the rules and regulations at the airport. If you are vaccinated, that is a green card. But then if you even not, and then you go through with the measures in place by going through the tests and then you are negative, yes, you are allowed, and then you can safely be in the country to do any business that you have in mind.
Thank you very much, Mr. Prepah, for this interview.
Thank you, Dr. K. It's a pleasure.